Yeah, greetings to you all. I'm Dr. Godfrey Zari Rukundo. I'm a psychiatrist and a senior lecturer at Mbarara University of Science and Technology, and I head the Department of Psychiatry from Mbarara Regional Referral Hospital and the Mbarara University of Science and Technology. So today we are going to talk about mental health and mental illness because it's very common and affects all of us. So mental health is what we all aspire to have. Just like the way we aspire to be healthy, we also need to be mentally healthy. And mental health has been described as a state of well-being in which the individual is able to achieve or at least realize their potential. This is according to WHO. But also that individual should be able to cope with the normal stresses of life, which other people also cope with. This same individual is supposed to be able to work fruitfully and productively. And they should be able to make a contribution to their community. So when somebody is not able to have those four characteristics, then we say they are not mentally well, or they are mentally sick, or they have something that is not yet addressed for them to say they are mentally healthy. So, but when people hear of mental illness, they only think of maybe eating from the garbage bins, or going naked, or fighting. But mental health is broad, and it affects everybody. No one is immune to mental illness. As long as you have a functioning brain, as long as you are living on earth, you can actually have a mental illness. There are several causes, there are several risk factors, but not everybody with these risk factors develops mental illness, because they are also protective factors. So for today, I want us to look at some of the conditions that we consider as mental illnesses or mental disorders. For example, we have one of the common disorders called depression. Depression is characterized by feelings of sadness, feelings of hopelessness, lack of sleep, poor appetite, and many other features. And as we realize, some of these features occur in normal life. Nobody can say they are always happy. There are moments when you feel sad, when you have lost someone, or you have lost something, or you have not achieved something that you have always wanted to achieve. But when these symptoms stay almost every day for a period of 2 weeks or more, then we say you are now developing depression. And if there is no intervention, it can become worse, and you can even go into severe hopelessness, and sometimes some individuals may think of suicide. So, but many times people do not think that depression is a disease. They think it is normal sadness. But usually when you're sad for a few minutes, a few hours, maybe a few days, but shouldn't go on for 2 weeks and beyond. When it reaches that period, then we know this is now depression, and you may need an intervention. And the depression may not be the same severity. It may be, we have different severity levels. It could be mild, it could be moderate, and it could be severe. And usually when it is mild and sometimes moderate, you can actually move on with life, continue functioning in many aspects. But once it becomes severe, then the functioning is affected. Whether it is occupational, and for students, it could be academic, it could be social, it could be family life, the functioning gets affected. So that is one of the most common disorders. And you may find that maybe 1 in 4 people has had a period of depression. But also there is another one called anxiety. Anxiety is very common, also part of normal life, but it has different forms. We have different forms of anxiety. There's what we call generalized anxiety disorder. There is a panic disorder, there is social anxiety disorder, and many others. They are very common. And unfortunately, they are not usually diagnosed, and therefore individuals never receive the appropriate care. And yet, their functioning in society is affected. For example, when you have like social anxiety disorder, it may be difficult for you to stand in public and do something, or speak, or stand for your own rights. You may just fear being the point of attention. And yet when you don't do that, then you miss out on what you are supposed to get. There are people who fear like flights or heights. You may miss an opportunity to go to maybe a storied building, or to fly, to travel by air. Or there are those who fear crossing bridges or traveling by boat just because of the anxiety. So if you fear something like that, then you miss opportunities. You may not be able to function if you are required to function in such a situation. So, and then there are other conditions like bipolar affective disorder, where the individual presents with episodes when they are having features of depression, and other times they are very excited, they are very happy, they are like on top of the world. They are very excited. And they are very disinhibited during that time. They are not able to control their emotions. In such a situation, somebody may not be able to function. And in between those episodes, they may be able to present as if now they are no longer sick, they are now stable. And then after some time, these symptoms come back. And then we have substance use problems like alcohol use. Now we have cannabis, we have other drugs of abuse. Like among the health workers, now we have many people using pethidine, which is supposed to be a drug used to control pain in patients with severe pain. Now people are also addicted to it. They take it for their own satisfaction. So we have substance use as a big challenge, and you have seen, I think, in every community, you cannot fail to get somebody who is an alcoholic, and maybe who has failed to sustain a family, or who has failed to function, or who has failed to study, or who has failed to work. So substance use is a common problem, and now among the youth, we have a lot of cannabis and other drugs of abuse, including cocaine and heroin and so on. And then also now recently we have now gambling, we have addiction to pornography and many other behaviors and substances that people get addicted to. So then we have other conditions which come like in children. We call them childhood mental disorders, like one we call attention deficit hyperactivity disorder, where a child is not able to pay attention to maybe a specific activity like class. They are not able to sit still when they are supposed to be sitting still. They are not able to concentrate, and therefore they end up performing badly, and they are being punished by the teachers when they are not understood. And at the end of the day, they are not able to achieve as students. We have another condition called the autism spectrum disorder, where the child has issues with social interaction, they have issues with relationships, and they have issues with language. They are not able to express themselves verbally, but also they are not able to express themselves non-verbally. So as such, they are taken maybe to be mentally retarded, even when their IQ is normal, and they are therefore not understood, and they may not be able to learn properly just like other children learn. They may need to learn in in a special way or in a different way. So if they don't access such a skilled teacher or an environment where they can learn, most likely they won't be able to get what they are supposed to get as students. So there are so many mental disorders. I have just mentioned a few, but there are so many. I think the others maybe have not mentioned include like post-traumatic stress disorder, obsessive compulsive disorder, and many others. So somebody may wonder, but who is safe? As I mentioned earlier, no one is safe. As long as the brain is working, somebody actually can develop a mental illness. Among the elderly, we have dementia and other neurocognitive disorders. And I think now we are seeing it as if it is an epidemic, especially in Uganda. There are so many old people with memory problems, with disorganized behaviors, and families are struggling to take care of them. So somebody may wonder, what causes this? There are so many causes. One of them is the genetics. There is genetic predisposition. There is a risk or a familial risk that if you have somebody with mental illness in your family, there is a higher risk that you can also get it. But also there are some environmental factors. If you live in an environment that is stressful, an environment where you lack so many things, like you are deprived of so many things, maybe you lack social support, you lack people to give you advice, there are no role models, no one to support you, the risk of developing a mental illness is high. And then of course if you take substances or you have been exposed to trauma, you have been exposed to abuse or neglect, especially when you are still young, the risk of developing mental illness is high. Or if you aim too high, like you set very high goals that you cannot achieve, and then when you don't achieve them, you become disappointed with yourself, the risk of becoming depressed or becoming anxious is also very high. So there are so many issues that can easily cause mental illness or put you at risk of mental illness. And unfortunately, some of these issues cannot be prevented. You just have to see how to cope with them or how to go through them or how to reduce the risk. But it is difficult to completely take away the risk of mental illness. So I have mentioned the many mental disorders coming or being experienced by different people. So somebody may wonder, so when can somebody develop a mental illness? As I have mentioned, mental illnesses occur at different stages. Among the children, among the adolescents, middle age, and the elderly. But we notice that about 50% of the mental disorders we see in adults actually start by the age of 14. And by the age of 25, by the age of 25, we have about 70% of the mental illnesses already evident in the individual. So maybe if you are already above 25, the risk is less compared to somebody who is younger. Among the young people, I think they go through a lot of stress. They have to cope with so many things. They are still in school. You know, school is not an easy thing. They are still differentiating from being adolescents to becoming adults, or becoming adolescents from being children. So those transitions are quite challenging. And I think that's when people get stressed and they break down for the first time. But also that's when people explore new behaviors. That's when they get into addictions, and that's when also they break down when they try to do that. And when you have a mental illness, what can be done? There is hope even when you have a mental illness, because there is treatment. For example, we have medical treatment, we have medications. Almost all the disorders have medical treatment. And these medications are available in government facilities, but also in private facilities. For example, in this region, in Western Uganda, we have like Mbarara Regional Referral Hospital, we have Kabale Regional Referral Hospital, we have Kampala International University Teaching Hospital, we have Fort Portal Regional Referral Hospital, we have Masaka Regional Referral Hospital. Those hospitals have psychiatrists, have psychologists, have psychiatric clinical officers, and they can be able to assess and treat all these mental disorders. But also at lower health units, the health center 4s, health center 3s, there are now people with the training in mental health. For example, we have PCOs, the psychiatric clinical officers, and psychiatric nurses. But also recently, through the mental health gap training, we have trained at least 10 primary healthcare workers in all the districts of southwestern Uganda. And they are able now to assess and treat mental illness. And where possible, where not possible, they are able to refer to their nearest health facility where somebody can be helped. And these services are free in the government health facilities. But of course, if you find a medication is not available, then they are able to give you the prescription and advise you to go to the pharmacy or a drug shop where you can be able to get this medication. But in case maybe somebody is not able to get treatment here in Western Uganda, they can go to other regions. All the regional have at least somebody who has training in mental health. And of course, we have one referral hospital, national referral hospital, that is the Butabika National Referral Psychiatric Hospital, which has specialized psychiatric services, including the alcohol and drug unit. And it is now rehabilitated recently, and it is a very good hospital, and people can get care from there. But also now we have other non-governmental organizations in communities like TPO, Tutapona, and many other non-governmental organizations which can actually offer psychiatric help even before situations become worse. So I talked about medical treatments, but also there could be psychological treatments where somebody is given talk therapy. Commonly we call it counseling, and there are different types of talk therapy where somebody can be supported just through talking, giving ideas, sharing experiences, and where necessary giving advice. So not everybody with a mental disorder requires to take medical treatment. And people with the addictions and the people maybe who have gone through a lot of struggles with mental illness, they can also be taken to rehabilitation centers. So they are taken through strategies of how they can cope with their challenges and be able to move on with their disabilities. And this one includes even people with epilepsy, which is still being treated in psychiatric units in most of the country. But at least now in Mbarara Hospital, most of the patients with epilepsy are treated in the epilepsy clinic, which was established a few years ago. So it is able to run. So there is rehabilitation and there is hope. So I think this is maybe a general overview of what I could say about mental health and mental illness. And mental illness is treatable, and people recover and they go back to work and they live independent lives. Having a mental illness does not mean that you write somebody off or you write yourself off. You can be treated, you recover, and you move on, either with studies or with work or with your family life, whatever you have been doing. You don't have to kill yourself or give up on life, because you can be helped. There are so many professionals who are well qualified to give you assistance. I wish you all the best, and the hospital is open. My office is open. You can come and we discuss if you think that you have an issue. But maybe you may ask, how do I know that I have an issue? Yes, I have talked about some of the symptoms. So if you think maybe you are not sleeping well, yet you are not having any pain, maybe your appetite is low, maybe you are not happy as you would expect, maybe you are anxious when others are not anxious, like you are sweating too much, maybe your heart beats very fast when there is nothing that is scaring. Maybe you are now losing interest in the things you used to enjoy previously. Or maybe people are complaining about your behavior. They think you have changed. Or they think you are no longer as enthusiastic as before. Or they think you should seek help. Or you have tried to treat maybe some symptoms and they have not gone. You can come for assessment and we see whether there is a possibility that your mental health is being affected. I wish you all the best, and we are looking forward to receiving you. God bless you.
You're watching AYIT TV, empowering you.